Hello viewers, welcome once again to my YouTube channel. And today's topic, I've taken a very simple and a very most interesting topic, what is called as hallucination. So, hallucination sometimes, in whether it be medical or be nursing, it has been found that they understand what is hallucination. So, hallucination can be understood as it's a kind of a feeling or a false perception where an individual is feeling something what is actually not present. A sensation or a perception that is actually not present is called a hallucination. So, when we look at the definition of it in medical terminologies, it has been said that hallucination it is a false sensory perception. So, that false sensory perception is going to exist, and the perceptual existence of certain feelings or sensations that do not exist in reality, it is called as hallucination. So most often it is found that this kind of a hallucination, it is mostly seen in either it can occur in all the five senses or it can be there in the bodily sensations as well. So on a broader aspect, when we look at this, hallucination can be broadly subdivided into five types. So, depending upon the sense organ, the five types of sense organs, this hallucination can be broadly subdivided. And depending on what all sense organs do we have, that is the sense of sight, that is the visual hallucination, the sense of hearing, that is the auditory hallucination. After that, we have the olfactory hallucination, where the smell of sense is being a false perception of a smell is there, and tactile hallucination, that is the feeling of touch, the gustatory hallucination, where a particular feeling of taste has been a false perception of a certain taste is being seen, and last but not the least, that is the general somatic hallucination. So in this video we'll be slowly and gradually we'll be moving on, and we'll be discussing every type of hallucination, and we'll try to understand them as to how it is, what are the causes of this. So when we look at the visual hallucination, so visual hallucination, it's actually meaning that it is a false visual perception. So the patient, the persons who are experiencing it, actually there is nothing in front of them. The original stimuli, the without the presence of any stimuli, they can feel that something is present right in front of their eye. So that is a visual hallucination, and there is false visual perception of things, what is of any stimuli what is not presented to them. So such kind of a hallucination is mostly seen in certain patients who are having certain kind of mental disorders. So this visual hallucination is seen in most of the patients who are having certain kind of mental disorders like dementia, delirium, or certain kinds of drug, the patients who are having mania, and in certain kinds of alcohol addiction or certain kinds of drug addiction, this visual hallucination is being reported by such persons. Now, moving on to the next, the most interesting one, it is the auditory hallucination. Although it has been seen that certain hallucinations, most of the patients, the for most of the persons, these hallucinations, it is not a pleasant one, and there are chances that the persons who are experiencing these hallucinations, they are mostly frightened or threatened by it. In rare of the rarest cases, there are people who have reported that these hallucinations are quite pleasant to them. In other cases, most of the people, what we naturally find is that by such hallucination, most of the people, they are frightened or they are threatened. Now, moving on to the auditory hallucination, means there is some kind of a false auditory perception without any stimuli. So, instead, in their surroundings, there is a such no nothing, no sounds are there, but such persons are going to experience certain kind of a false hearing, false sounds they can hear. Either it can be sounds by it can be either a sound of a buzzing sound or a hissing sound, it can be seen. And patients, there are certain patients, these auditory hallucination can be either in the form of, there are certain people who are constantly saying certain things to them. So these verbal commands what are there in auditory hallucinations, what do we find is that the patients, they hear voices, what they are, someone is talking to them. Either those voices, what he is hearing, can be either of a complimentary nature, or it can be of a critical commands, or it can be a neutral comments. Neutral comments, sometimes the patients can